Hello, my name is Julia Terrell. I'm doing a community health project for college. This is June of 2022. My community project is focusing on the older population within the community. So nutrition is the topic I'm going to discuss along with exercise. I'm trying to address the community health issues that's ranked the highest, which is going to be heart disease and obesity for my community. We also have the 8th highest rate of Alzheimer's. The obesity rate is actually the 3rd highest within the nation. So obviously, these are the big topics that we need to address regarding health issues in my community. First, let's define what a community is. Community, that is a group to which we belong. These are permanent human experiences that are important assets within our lives. This is something that we cannot escape. We're all going to belong to certain groups and certain communities. These communities are going to affect our health and well-being. What one individual does will affect our behavior in the long run. Examples of communities includes neighborhoods, political parties, professional organizations that we may belong to. All of these are examples of communities. In the PowerPoint below, you can see all of the different resources that we have available within the city. Examples of this regarding healthcare is going to be all the ambulatory primary care providers that's available, the chiropractors, dialysis clinic, physical therapy services, dentist, facilities that actually provide private caregivers, UAB freestanding ER, which we acquired approximately 3 years ago. You can see many other listed resources such as shopping centers, restaurants, gas stations, 3 parks for recreation. The 3rd one's actually under construction currently. We have Head Start and daycare, satellite court office. We have 3 vets within the city. And there's also the choice of public or private schools located within Gardendale. So Gardendale's population is approximately 11,000 residents. Birmingham, which is the largest city in the state of Alabama, it has a population of around 662,000. Gardendale is about 15 minutes north of Birmingham. It's a suburb. Caucasians makes up the majority of the population. It's approximately around 82%. African Americans is the second majority, around 9.5%. And there's 2 or more races that's making up 4% of the population. The median household income's around $59,000. While the median age of the residents in the city is around 45,000. So the average life expectancy is around 75 years of age for my community. Our marriage rates are around 4,600 a year, while our divorce rates is lower. We average around 2,100 per year. Now, we are the 3rd highest. We have the 3rd highest obesity rate within the United States. That's very high. 66% of the community actually reports being obese or morbidly obese. That's extremely high. And Alabama is ranked as the 6th leading cause of death within Alabama is Alzheimer's death. We average around 2,600 per year with Alzheimer's deaths. So my county's primary health concerns is going to be heart disease, smoking rates, decrease in those because that's related to heart disease as well, and addressing the problem of obesity. And also we need to stress the importance of exercise within our life, exercise both physically and mentally. My diagnosis is risk of effective health maintenance related to life changes associated with aging and making poor nutrition choices among clients at Gardendale Senior Center. The senior center within my city is the population that I chose to work with during this project. My community is really reserved. It's highly influenced by the church. An example of this is you can find 25 different churches located within a 3-mile radius of the city. We're highly influenced by the First Baptist Church. This is the largest church within the community. They actually have a cross that's located beside Interstate 65 so that everyone traveling northbound and southbound can observe it. This cross is actually 125 feet tall. That's pretty massive. So my objectives and goals includes the short-term goal was 50% of the seniors would be able to complete the survey, and they would be able to complete it accurately, meaning 50% of them would be able to verbalize 2 benefits of exercise. My second goal, the short-term goal, was the fact that 50% of the members would also be able to list 2 of the 4 food groups that we have. The third long-term theoretical goal from this project is members will be able to make proper, healthier food choices by December of 2022. And this can be acquired by providing 15 minutes of nutrition education through the week, Monday through Friday, to all the members that's attending lunch or any other activity within the center. And by December, 85% of these members will actually be able to complete the survey accurately. And they will be able to complete it accurately by, again, answering 2 benefits of exercise and being able to list 2 of the 4 food groups. So 2 of my community partners was going to be Gardendale Senior Center and the facilities director, Ms. Burgess. The Senior Center actually provides a great deal of services, more than what I realized. They provide meals to seniors that can attend the facility Monday through Friday. They provide entertainment, such as various bands that come to the center. They provide lunch, and they also provide community meals. People within the city limits gets meals delivered to them if they're homebound seniors. And this was provided through United Way. Another service that you can find that's located within the entire county is going to be online communication. This online communication is created to try to meet the socialization needs of seniors that are forced to stay at home within the entire county. Again, that's Jefferson County. And some other resources that they can find through the Senior Center's services is going to be like incontinence supplies. They can go and get resources for evaluations for dementia or Alzheimer's, housing assistance. Other sources of information is going to be like the senior pageant, the senior expo that's located within Jefferson County. So you can see some of the various resources that they can obtain. Some of my community interventions that was used is going to include the elderly nutrition program. This was a big resource for me when I was acquiring a lot of my nutrition information. Also utilize my plate. I've got a picture, which you can see later in the presentation, that addresses all the 4 food groups that we discussed in my nutrition education session that was provided to all the members at the Senior Center. One of the community interventions that I actually provided at the center was going to be games. Bunko was the main game that I provided. We actually incorporated prizes for this to make it a little more fun for the seniors attending. And what I did, I got people to volunteer some prizes, and I also used some couponing techniques for acquiring the prizes so I could keep it as cheap as possible. And the Bunko was the game that we played. This was actually a more difficult game than what I anticipated, which is not that difficult. I just wasn't used to keeping up with the score. So I actually used the volunteer coordinator at the Senior Center. She showed me how to do this one day while I was there at the facility. It was a fun process getting to talk to everybody and learn everything that was going on at the center. I actually created a booklet of information for the seniors, for all the seniors that were attending the senior center in Gardendale. Originally, I'd created enough booklets to cover both members at Gardendale Senior Center and Kimberly Senior Center. Kimberly is the next suburb that's neighboring Gardendale, about 10 minutes from Gardendale. Anyways, they had at the Kimberly Senior Center, they had a bad outbreak of COVID during our project, so I ended up utilizing Gardendale Senior Center in the end. Kimberly Senior Center was closed, I don't know, for about 2 weeks, 2.5 weeks. I haven't got confirmation if they've opened back up or not. The last time I talked with the director there, though, she sounded really bad. She was sick with some laryngitis. Anyway, Gardendale was the senior center I focused on in the end. I created over 50 booklets for all of them. I plan on taking the remainder of the booklets over to Kimberly's whenever I do verify that they are in fact open again. On the next slide, you can see the 4 food groups listed. This was the picture I printed out in color for my project. I wanted to do it in color so it would stimulate the older people attending the educational session of my project. This covered, proteins, meat, beans, fish, chicken, grains was stressed, the importance of grains, getting healthy grains within our diet. And then, of course, we had our dairy products that we needed to cover, then our fruits and vegetables. We covered a lot of topics regarding nutrition, the importance of exercise, the importance of getting enough fluids, the importance of not drinking too much caffeine. That was what one member had actually asked a question about during the presentation, because a lot of the members there had experienced some significant issues with dehydration regarding like passing out, things of that nature. Some of them seemed to think that drinking sodas was part of our fluid intake, and I had to explain the importance of not drinking too much caffeine to them, and of course getting the recommended amount of fluids during the day, 8 cups of water. So that is the conclusion of my presentation. I hope all of you guys enjoyed it. Thank you. Bye.